Neonatal seizures are very common, up to 2% of live births. The most common cause is HIE. I was asked about that during the break, and that is just something you have to know. HIE, neonatal seizure, most common cause. We also see neonatal meningitis and encephalitis, of course, so getting CSF testing, particularly for HSV, you do not need to have any sort of obvious stigmata or risk factor of HSV. So I've definitely seen cases where the kid had HSV and the family had no idea, right? And presumably they probably had prenatal testing. I don't know how that works anymore, but bottom line is the kid had HSV, and it doesn't, so making sure we keep that on our differential, even if it's like they got kissed by somebody, like grandmother visiting or something like that, and that's how they got, who knows, right? But you can get HSV1 or HSV2 neonatally, and that can cause seizures, and it doesn't necessarily have to come from birth or peripartum. And then metabolic disorders, relatively rare, and same thing with genetic, but we do see them, so be mindful of them. IVH can also cause seizures, less common overall than HIE. And then there's a fun thing called benign familial neonatal seizures, or fifth-day fits. We call it that because the seizures typically happen between 4 and 6 days of life. So on the 5th day of life, you get these seizures. They're benign, they run in families. So you ask grandma, does anyone have this in the family? And they say, oh yeah, everybody that's born in our family has this. And then it's benign familial neonatal seizures. You actually don't have to do any testing for that. You can do genetic testing if you want, but you don't have to do LP and MRI and all that stuff if you have a clear clinical history and family history of that. For HIE seizures, these kids often end up on meds, sometimes more than one. We want to wean meds before discharge if possible, or shortly after discharge. So it depends on your institution. Some places will say, we got to get them off like phenobarb, because phenobarb's not a great medicine to be on long term. We got to get them off phenobarb before they leave the hospital. Or if you have like a rapid follow-up, NICU follow-up clinic where they're seen like 2 weeks after discharge, you could just wean it off then.